Although bone cancer is relatively rare, it is a serious condition that can profoundly impact an individual's health and quality of life. Early detection is vital, as it greatly enhances the likelihood of successful treatment and survival. In this video, we'll be diving into the 12 warning signs of bone cancer that you should never overlook. Make sure to stay with us until the end, as the last symptom we'll cover might just be the most crucial one for you to know. By understanding these symptoms, you can take swift action to seek medical attention, potentially saving your life or that of someone you care about. Additionally, we'll reveal 3 common foods that you may be eating every day, which could increase your risk of cancer. Trust me, you'll want to reconsider your diet after learning about these foods. So, are you ready to dive in and arm yourself with this essential knowledge? Let's get started. 1. Persistent pain. Persistent pain is often the most prominent and initial symptom associated with bone cancer. Unlike the general aches and pains that one might experience from time to time, the pain linked to bone cancer is notably different. It tends to be consistent, progressive, and intensifies over time. Whether it manifests as a dull ache or a sharp, piercing sensation, this pain can be particularly noticeable during the night or with physical activity, making it hard to ignore. The underlying reason for this persistent pain lies in the growth of the tumor within the bone itself. As the tumor expands, it causes inflammation and exerts pressure on the surrounding tissues, resulting in significant discomfort. Ignoring such persistent pain can be detrimental, as it may delay diagnosis and treatment, allowing the cancer to advance unchecked. If you find yourself experiencing unexplained, continuous pain in a bone or joint that does not subside with rest or over-the-counter pain relief medications, it is crucial to seek the advice of a healthcare professional. They will likely recommend a series of imaging tests, such as X-rays or MRIs, to accurately determine the cause of your discomfort. Early detection and prompt treatment are key in managing bone cancer effectively. 2. Swelling and lumps. Swelling and the presence of lumps on or near a bone can be significant indicators of bone cancer. It's important to understand that this swelling may or may not be associated with pain, making it easy to overlook or misinterpret. Often, such physical changes can be mistaken for other conditions, such as infections or benign growths, which highlights the necessity for a thorough medical evaluation. As a tumor grows, it can cause noticeable changes in the affected area, such as the development of lumps or swelling. These changes may be subtle at first, but early detection of these physical anomalies can facilitate prompt medical assessment and intervention. Recognizing these signs early can make a considerable difference in the management and treatment of potential bone cancer. If you observe any unusual swelling or lumps on your bones, especially those that persist and do not resolve over time, it is crucial to seek medical advice. Your healthcare provider may suggest a biopsy, a procedure where a small sample of the lump is taken and examined to determine whether the lump is cancerous. This step is vital in establishing an accurate diagnosis and formulating an appropriate treatment plan. 3. Fractures and weak bones. Bone cancer has the unfortunate effect of weakening the structural integrity of bones, making them significantly more prone to fractures. This vulnerability means that bones can break with minimal or even no trauma at all, which can often serve as a critical warning sign of underlying skeletal issues. When cancer compromises bone strength, the likelihood of fractures increases dramatically. Recognizing a recurrent pattern of easily broken bones should prompt immediate medical attention. Such patterns are not merely coincidental, but can indicate serious health concerns that warrant further investigation. Early detection of bone cancer can pave the way for timely and more effective treatment. Therefore, if you or someone you know experiences an unexplained fracture or a fracture resulting from a seemingly minor injury, it is imperative to consult a healthcare provider. In such cases, doctors may recommend various imaging tests to evaluate the bone's strength and check for the presence of any tumors. 4. Unexplained fatigue. One of the more insidious symptoms of bone cancer is chronic, unexplained fatigue. This type of fatigue is persistent, severe, and often does not improve with rest, substantially affecting daily activities and diminishing overall quality of life. Unlike ordinary tiredness, cancer-related fatigue stems from the body's response to the tumor and its efforts to combat the disease. Identifying this symptom early is crucial, as it can significantly hasten the diagnostic process and lead to a quicker formulation of an effective treatment plan. Persistent, unrelenting fatigue should not be ignored. If you find yourself continually exhausted without a clear reason, it is advisable to speak with a healthcare professional. They may conduct a series of blood tests and other evaluations to pinpoint the underlying cause and determine if cancer is a contributing factor. 5. Weight loss. Weight loss can often be the goal for many individuals, especially those pursuing a healthier lifestyle. However, when weight loss occurs unintentionally and without any changes to diet or exercise routines, it can be a cause for concern. Particularly in the context of significant weight loss, this may serve as an alarming indicator of underlying health issues, including bone cancer. When we talk about unintentional weight loss in relation to bone cancer, it's important to recognize that this symptom does not arise from a change in lifestyle habits. Instead, it is a reflection of the body's internal struggle against the disease. Bone cancer increases the body's metabolic demands as it attempts to combat the tumor, leading to the consumption of more energy and consequently weight loss. The mechanism behind this weight loss is complex. Cancer cells consume a large amount of the body's energy and resources, diverting them away from normal bodily functions. Additionally, the presence of cancer can lead to the release of certain substances in the body that alter metabolism, further accelerating weight loss. 6. Fever and night sweats. Experiencing fever and night sweats, especially when they persist over time, can sometimes be associated with bone cancer. These symptoms often appear alongside other signs and can indicate the body's response to the presence of a tumor. Fever and night sweats are systemic symptoms, meaning they affect the entire body rather than just a specific part. These symptoms suggest that the body is under considerable stress and might be fighting off an infection or dealing with a malignancy. Recognizing these symptoms early is crucial, as it can lead to timely medical evaluation and intervention. If you find yourself experiencing persistent fever and night sweats, it is important to pay attention to your body. When these symptoms occur in conjunction with other signs, it is highly advisable to consult a healthcare provider. They are equipped to perform a thorough evaluation, which may include a series of tests designed to identify the underlying cause of your symptoms and rule out serious conditions such as cancer. 7. Reduced mobility. Bone cancer can have a profound impact on physical mobility, especially when a tumor develops in proximity to a joint. This condition often manifests through symptoms such as stiffness, a reduced range of motion, and challenges in performing routine daily activities. These signs are not just discomforts. They can be significant indicators of underlying health issues, including bone cancer. Mobility issues can drastically alter one's quality of life. The ability to move freely and without pain is something many take for granted until it is hindered. When a joint becomes stiff or movement is restricted, it can affect every aspect of daily living, from walking and climbing stairs to simply getting dressed. This reduction in mobility is not merely inconvenient, it can be a critical early warning sign of bone cancer, emphasizing the importance of early detection and intervention. If you experience persistent stiffness or difficulty in moving a particular joint, it is crucial to seek medical advice. Your healthcare provider can conduct a thorough physical examination and may utilize imaging tests such as X-rays, MRIs, or CT scans to identify the root cause of these symptoms. Early diagnosis is key to managing bone cancer effectively, and recognizing these mobility changes can lead to timely and potentially life-saving treatment. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. 8. Anemia. Anemia is a condition characterized by a reduction in the number of red blood cells, leading to decreased oxygen delivery throughout the body. This condition is often a sign of underlying issues, including bone cancer. When the bone marrow is affected by cancerous cells, it can impair the production of red blood cells, subsequently resulting in anemia. Individuals with anemia may experience a range of symptoms such as persistent fatigue, a general sense of weakness, and shortness of breath. These symptoms can significantly impact daily activities and overall quality of life. Understanding and recognizing these signs are crucial as they can serve as important indicators prompting further medical evaluation. Bone cancer can disrupt the normal functioning of the bone marrow, leading to a compromised ability to produce sufficient red blood cells. This disruption often manifests as anemia, making it a critical symptom that requires attention. Early detection of anemia can facilitate timely diagnosis and intervention for bone cancer, potentially improving treatment outcomes. 9. Nerve pain. Nerve pain, also known as neuropathy, is a condition that may arise when a bone tumor exerts pressure on neighboring nerves. This pressure can manifest as a variety of uncomfortable sensations, including tingling, numbness, or sharp and shooting pains in the affected region. These symptoms not only cause discomfort, but also serve as important indicators of the tumor's precise location and its influence on the surrounding tissues. Recognizing the early signs of nerve pain is vital, as it can facilitate prompt medical intervention, potentially leading to more effective management and better outcomes. Should you find yourself experiencing any unexplained nerve pain or other neurological symptoms, it is crucial to seek medical advice without delay. Your healthcare provider is likely to perform a series of neurological examinations and imaging tests to identify the root cause of your symptoms. 10. Changes in skin over the bone. Changes in the skin over a bone, such as the appearance of redness, warmth, or prominent veins, can serve as potential warning signs of underlying bone cancer. These alterations may result from the tumor's impact on local blood supply or due to the inflammation it causes within the affected area. Recognizing visible changes in the skin can act as external indicators of internal health issues. Such visible symptoms are crucial as they can prompt timely medical attention, leading to further evaluation and early diagnosis. Early detection is vital because it often improves the prospects for effective treatment and better outcomes. If you observe any unusual changes in the skin overlying a bone, it is important to consult a healthcare professional without delay. They are likely to recommend a thorough physical examination and may also suggest imaging tests such as X-rays, MRIs, or CT scans to accurately determine the underlying cause of these changes. 11. Difficulty with daily activities. Bone cancer can significantly disrupt daily life, making even the simplest tasks a challenge. Activities that were once second nature, such as walking, climbing stairs, or lifting objects, may become difficult to perform. These functional impairments can have a profound impact on an individual's quality of life and may serve as early warning signs of bone cancer. Such impairments should not be ignored, as they can provide crucial insights into underlying health issues. Promptly recognizing these changes can lead to earlier medical intervention, which is vital for managing bone cancer effectively. The sooner these symptoms are addressed, the better the chances of improving treatment outcomes and overall well-being. If you find yourself struggling with persistent difficulties in your daily activities, it's essential to seek medical advice. A healthcare professional may conduct a thorough physical examination and recommend imaging tests, such as X-rays or MRIs, to pinpoint the cause of these symptoms. Early diagnosis and intervention are key to addressing and managing bone cancer and ensuring the best possible care. 12. Chest pain and breathing difficulties. When it comes to understanding the progression of bone cancer, it's important to recognize the seriousness of certain symptoms. Chest pain and breathing difficulties are two such symptoms that can emerge when bone cancer metastasizes to the lungs. These symptoms can be quite severe and are often accompanied by other indications of bone cancer, making it crucial to address them promptly. Respiratory symptoms, such as persistent chest pain and difficulty breathing, may signify that the cancer has spread beyond the bones. Identifying these signs early on is essential, as it can lead to swift medical evaluation and timely intervention. Early recognition of these symptoms can play a pivotal role in managing the disease and improving the patient's overall prognosis. If you experience any persistent chest pain or breathing difficulties, especially if they occur alongside other symptoms of bone cancer, it is imperative to consult a healthcare provider. A professional will likely conduct a series of evaluations, including imaging tests like X-rays, CT scans, or MRIs, to determine the cause of these symptoms and assess for potential metastasis. Seeking medical advice at the first sign of these symptoms ensures that any underlying issues are addressed promptly, leading to better management and treatment outcomes. In conclusion, recognizing the warning signs of bone cancer is crucial for early detection and successful treatment. Persistent pain, swelling, unexpected fractures, fatigue, weight loss, fever, reduced mobility, anemia, nerve pain, skin changes, difficulty with daily activities, and respiratory symptoms can all be indicative of bone cancer. If you experience any of these symptoms, it is essential to seek medical advice promptly. Early intervention can significantly improve outcomes and potentially save lives. Now let's talk about the 3 common foods that you may be eating every day, which could increase your risk of cancer. You might be surprised to learn that some of the foods you consume daily could be increasing your risk of cancer. We will delve into the details of why these foods are harmful, explore the scientific evidence behind these claims, and provide practical tips for making healthier choices. So, let's get started. 1. Processed meats. Processed meats include items such as bacon, sausages, hot dogs, salami, and other cured, smoked, or salted meats. These products often contain chemical preservatives and additives to enhance flavor, texture, and shelf life. The primary concern with processed meats lies in their preparation methods and the chemical compounds used in their production. When meats are cured, smoked, or salted, they often produce carcinogenic compounds such as N-nitroso compounds and polycyclic aromatic hydrocarbons. Additionally, processed meats can be high in saturated fats and sodium, which contribute to other health issues. Numerous studies have linked the consumption of processed meats to an increased risk of various cancers, particularly colorectal cancer. A report by the World Health Organization has classified processed meats as Group 1 carcinogens, meaning there is sufficient evidence to conclude that they cause cancer in humans. A study published in the Journal of the National Cancer Institute found that individuals who consume processed meats regularly have a 20% higher risk of developing colorectal cancer compared to those who do not. 2. Sugary beverages. Sugary beverages encompass a wide range of drinks, including sodas, fruit juices with added sugar, energy drinks, and sweetened teas and coffees. These drinks are typically high in sugar and provide little to no nutritional value. Excessive consumption of sugary beverages can lead to several health problems, including obesity, type 2 diabetes, and heart disease. The high sugar content in these drinks contributes to the development of insulin resistance, inflammation, and oxidative stress, all of which are risk factors for cancer. Research has shown that consuming sugary beverages is associated with an increased risk of certain cancers. For instance, a study published in the British Medical Journal found that higher consumption of sugary drinks was linked to an increased risk of overall cancer and breast cancer. The study observed that just a 100 milliliter increase in daily sugary drink consumption was associated with an 18% increased risk of cancer. 3. Refined grains. Refined grains are grains that have been processed to remove the bran and germ, leaving only the endosperm. This process strips the grains of essential nutrients, including fiber, vitamins, and minerals. Common examples of refined grains include white bread, white rice, pastries, and many breakfast cereals. Refined grains have a high glycemic index, meaning they cause rapid spikes in blood sugar levels. These spikes can lead to insulin resistance, increased inflammation, and oxidative stress, all of which are associated with an elevated risk of cancer. Additionally, refined grains often contain added sugars and unhealthy fats, further contributing to their adverse health effects. Several studies have linked the consumption of refined grains to an increased risk of cancer. For instance, research published in the American Journal of Clinical Nutrition found that diets high in refined grains were associated with a higher risk of colorectal cancer. Another study in the International Journal of Cancer reported that a high intake of refined grains was linked to an increased risk of breast cancer. While the foods mentioned above are common in many people's diets, it is crucial to be mindful of their potential risks and make informed choices. By reducing your consumption of processed meats, sugary beverages, and refined grains, you can significantly lower your risk of cancer and improve your overall health. Remember, making small, gradual changes to your diet can have a lasting impact on your well-being. Stay informed, stay healthy, and take charge of your dietary habits today. If you found this video helpful, please share it with others. Your knowledge and awareness can contribute to a larger, safe, and healthy community. If you have any questions, experiences to share, or thoughts on this video, feel free to leave a comment below. Your input and engagement are valuable to us. Thank you for watching.